All right, let's go. Who would like to start? Go ahead,
I have a
Adam.
question about Ramadan this year.
Yes.
I guess maybe, how are you encouraging people to celebrate? How are you celebrating?
So I'm still trying to figure out if the moon has been sighted, so I'm going to assume Ramadan starts tomorrow. And last year at this time, just like with Easter, I said, we're going to have to celebrate in a way we never have before. And again, this year, same thing, one more. I'm happy to have authorized the broadcast of the call for prayer at sunset every day. That was a very sweet thing last year to do, which just helped people feel like they were in community, even though they couldn't gather for evening prayers or for the iftar, for the breaking of the fast. And we're going to have to do that again this year. And remember that it will live in your heart, even if we can't be congregational. And it's very unlikely that 30 days from now, we'll be able to have 10,000 people in a tent to celebrate Eid. That is too bad. But in the meantime, remember that Ramadan is a time for us to remember community and a time for us to remember charity and how we look after one another. So I'm really encouraging all Muslims to keep Ramadan this year, but also to keep it in a way that's focused on the needs of our community. And of course, the most important things we can do is to keep ourselves and others safe. And of course, a big part of that is to get vaccinated and to avoid unsafe situations.
Mayor, can you tell us about your efforts to convince the province to allow firefighters to get the vaccine?
I really do believe that if we are having essential healthcare workers being vaccinated starting today, which is awesome, I think it's great. I was in the hospital for an appointment recently and talking to a physiotherapist who was shocked that physiotherapists who are hands-on with patients and speech-language people had not been vaccinated yet. So that's great. But I would remind the province that firefighters are also healthcare workers. They respond to medical emergencies every day. They're in contact with people. They can give mouth to mouth. They can deal with bodily fluids every day. So we should treat them the same as other healthcare workers. But that said, I would like to get to an expanded phase 2C quickly, which includes an exposure-based look at this. So yes, we have done elderly people, awesome. We have done people with chronic conditions or are doing people with chronic conditions, which is really important. I have an appointment with my doctor today to see if I qualify under 2B. But I think the next step is 2C. And in 2C, I think that in addition to healthcare workers and first responders, we should include people who have risk of exposure. So those are people, bus drivers, for example, grocery store clerks, yes, teachers. Because we're at a point right now where we need to control the spread of the infection, not just severe outcomes. And I'm hearing a lot of scientists and doctors say it's time to shift our strategy away from those who are most risk of severe complications, because many of those people are being vaccinated now, to people who are at risk of catching and spreading disease.
Besides speaking out like this or at a council meeting, have you sent an email? Have you talked directly with the premier?
Yes, I have. And he has insisted that he is looking at the best scientific data and making his decisions, but that the points that I and others have been raising are things that they are taking under consideration right now.
With no time frame for an answer.
With no time frame for an answer yet.
Mayor, the Premier has said that he's confident that the Calgary Stampede will go ahead this year based on vaccination rates and things along those lines. I guess, are your hopes the same? And if you heard much about where progress is at with the possible Calgary Stampede this year?
Well, I am a member of the Calgary Stampede board, so I am privy to some of the planning, though I can't say too much about it publicly. I will say that last year, the Stampede tried very hard to ensure that we at least had some sense of Stampede spirit. We had drive-through pancake breakfasts, we had fireworks in the evening, and so on. And this year, I assume there will be more. I assume it will look a little more like a normal Stampede, but all of this depends on the spread of the variants, on our thoughts about safety outdoors versus indoors, and what is possible to do. So I wish I could tell you more. I know that we'll have an opportunity to celebrate something, but the Stampede Board and I are very concerned about doing so in the safest possible way, and that will always be our primary consideration.
It was end of April last year when we found out more detail. Do you know when an announcement might be coming this year?
I think it'll be later this year, because last year it was very clear which way we were going and it was bad. This year, it is clear things are going in a bad direction, but we're not clear where this vaccination versus variant race will end up. The federal and provincial governments have both promised that every adult Albertan who wants a vaccine will have their first shot by the end of June. I would imagine if they can accelerate that to say June 15th, so there's 2 weeks for people to build up immunity, then the decision will be very different if that is July the 5th, because the Stampede is right on the bubble of those dates.
Some municipalities in Ontario specifically have been very involved in advocating for different types of workers to be getting vaccinated sooner and to bring the vaccine to them through local clinics. It's a little bit different here because we don't have a good
We don't have a public health department.
But do you see Calgary getting involved in that level, or do you plan to be doing something?
Yeah, you know, look, we are available. Calgary Emergency Management are very good at logistical challenges. I know that I noticed this weekend myself, because sometimes I just go and look at the site and see how things are going, that many hundreds of appointments, if not thousands of new appointments opened up at the TELUS Convention Center. And that, of course, has the capacity to get up to 5,000 shots a day. The Genesis Center has the capacity to increase its throughput 5-fold. So we are definitely there, ready and willing to help. We may run into a situation, for example, where AHS might not have enough staff to actually give the vaccinations. And there are things that we can do. But my goal is to get those shots in arms as quick as possible and be helpful in every way we can.
Mayor, you know, I'm reluctant to get you to comment on councillor world, but I understand there's another person who works in the office of the councillor who billed for a significant sum of overtime last year. How many people do you think this affects?
I have no idea. You know, this really is, first of all, I cannot really speak to individual personnel issues, but I will also add that one of the challenges we've had with the Office of the Councillors is that they've operated relatively independently of the rest of the city. And I've raised that a few times over the years, but I think it's important now with a new chair of the Councillors Committee to really look at cleaning up that whole process of approval within the Councillor's office. I have no idea about it because it's very independent. It has nothing to do with the Mayor's office, but we got to do that. And you know, Council appointed a brand new Councillors Committee this September, because we felt that, or I felt, I shouldn't speak for all of council, I felt that I wasn't seeing the kind of oversight I would look for on that committee. So Councillors Maglioka, Chu, Farkas no longer on that committee, in the hopes that we can provide a little more oversight.
Just one other question I wanted to ask you was, the city or the administration seems to pin a lot of this on Councillor Jones. What share, I guess, of the responsibility that's resided with the former members of the committee no longer there, is it?
Well, I think this is really the issue, which is that committee had oversight responsibilities, and I think it's fair to say there are some questions about whether they were applying that oversight correctly.
When and how do we find that out?
I think asking the question is the important first step. All right?
Sorry, question about the Mr. Duckworth's report. What should Calgarians look to in these reports that are going to be coming up?
This is all about transparency and accountability, helping people better understand how their city government works. And one of the things that struck me today is, never mind the fact that we have laid off, sadly, an enormous number of our colleagues here at the city who are not yet back with us. But even before we did that, the fact that our workforce was as low as it was when the city had 25 or 30% fewer people is just a testament to how hard we've been working to ensure that we're building a very lean and very efficient government. And that is a testament to the leadership of Mr. Duckworth and his team. Okay?
Just really quick, just question on proposal about opening drinking in public parks. Just your thoughts on that, pros, cons?
Oh, you know, this is something that we talked about back in 2018 and thought that maybe we should see if it makes sense to, you know, everyone always has this very romantic view of it. People will have a little bit of wine with their beautiful picnic lunch. This is about guys drinking beer at their softball games, okay? Let's be clear. But that may not be such a bad thing, especially in a year where we're encouraging outdoor gatherings. So I'm very happy to use this year as an experiment, as we have used the last 2 years as experiments on many things, and just see how it goes.
Anything, just real quick, maybe on fee relief, as we're extending it, how important is making sure this fee relief is extended for this year?
Yeah, you know, we're not back to normal yet. Luckily, the city we've been burning through our savings pretty quickly on trying to help people through COVID, but thank goodness we had the savings. You know, I always say that we are the rare government that is the ant in the tail of the ant and the grasshopper. We set aside money when things were good so we'd have the ability to use it when things are bad. So yeah, this was the right thing to do. At some time tomorrow, council will be debating some assistance to people who can't pay their taxes on time, particularly businesses who won't be able to pay their taxes on time this year. And these are exactly the sorts of things we need to do. You heard today that Calgary is really at the forefront of providing assistance to people who've been badly hurt by COVID and businesses that have been badly hurt by COVID, and I anticipate we'll continue that. Okay, I really gotta go. Thanks, everybody.